Your grandfather,
Yeah.
your dad,
Yeah.
your brother, your twin,
Yeah.
are all dentists.
Yeah.
Is that why you were a dentist?
And I remember just saying to my father, I said, do you know what, I might do dentistry. And he said, you're not to do it just because of me. You're not to do it. And I said, I'm not doing it. He says, because it's hard work and, you know, it's a stressful job, but it's very enjoyable too. And I said to myself, do you know what, I might apply for it. So both Conor and I sort of pushed ourselves onto it. People do say to us, God, they find it strange, isn't it remarkable that you're twins and, you know, that you did dentistry together. To me, it was the most natural thing.
Yeah.
But maybe that's just being a twin.
Yeah.
So the first 1 or 2, 3 years are your hardest years,
Yeah.
very daunting. And then once you get over that, it takes a certain person to like dentistry.
When you got to about 27,
Yeah.
you must have been starting to sort of think, right, okay, I like that aspect of dentistry, or I don't like that aspect, or
Yeah.
what direction were you going in?
Well, I was doing a lot of sort of restorative dentistry. People arriving with sort of broken teeth.
Yeah.
And when I was 27 years old, I would individually think, right, I'm going to fix these teeth individually, you know,
Yeah.
which nowadays is probably the wrong thing to do, because it's like building a house. So it was like what we call single tooth treatment. So I'd see one tooth broken and I would just fix that.
Yeah.
And then there'd be another tooth broken, I'd go, that's another job.
Yeah.
And at the age of 27, 28, I remember going, there's got to be more to this and that,
Yeah.
you know. And I went to the Eastman Dental Hospital, did quite a bit of restorative dentistry. So there you learned great old-fashioned dentistry, proper dentistry. Do you know what, I want to do things correctly and properly, because I watched my father being a dentist for a long time, and he never, you know, disrespected anyone. He said the patient was always the priority. I really enjoyed rebuilding patients' mouths from start to finish. So a lot of people were doing a lot of cosmetic work, and it was failing. And the reason why it was failing, it was because they didn't know how patients' bites work.
Yeah.
So if you were charging, or patients are paying a lot of money to get this type of work done, you've got to make sure it's predictable.
Yeah.
And so from there onwards, I stopped doing a little bit of dentistry and started thinking I've got to start working out how to do predictable dentistry. In dentistry, it's stressful enough to be doing the surgery, but that's the easy part. It's when patients are, you know, their treatment plans are expensive, you've got to make sure that you can predict your dentistry. And if something does go wrong, it's not a disaster. You can correct it because you know what's going wrong. The more satisfying cases where you've got a patient who comes in and really needs your help. They are phobic. I know I can help them, you know. I can't cure them overnight, but they've got to trust me. Once you get a patient who actually trusts you, you can do anything. You'll get them over that line. Conor and I work together in a way that we feel that when a patient walks in, that they're getting it's a cliche word, but the whole care. So in other words, you come in, you don't get a quick exam and just go, there you go, and this is what you're going to get, and if you like it, you know, tough, you know. Sit down with the patient, tell them exactly what do they want. Instead of us telling them what they need, what do they want? What are they worried about? Is there any issues, anxieties? My father would always say, you know, treat everyone as if it was your mother or your sister. Yeah. And if you're in the NHS, you'd like to do that, but unfortunately, you're not going to turn around to your mother and say, time is up, you know, we've got to go. So when those shackles are off, and you can treat people like as if it was your parents or your brother and sister, well, then immediately your standards go up really high, and you do care, because naturally you are caring, and then it all falls into place from there. The approach for our dental practice would be very different compared to the average most dental practices. The first experience when you arrive to this practice would be a very detailed examination, which would be 1 hour. Being two brothers, we have the advantage, and quite remarkable in the fact that we have both different interests in dentistry. Even though we're twins, he'd be highly trained in surgery. He's probably probably the best implant guy I've seen. He would be placing implants every day, and he would be doing oral surgery. He'd be doing sedation for nervous patients. So that's his skill set, and he is highly trained in that. My skill set would be more cosmetics, restorative dentistry, a lot of occlusion, how people's bites work, facial pain clinics, TMJ, dysfunction. So again, everything in the clinic is done under one roof. So in our team, it's not just the clinical directors, Conor and Cormac, regarding the implants and the other dentistry, is that we have a fantastic team of 2 specialist orthodontists who deal with children's orthodontics and especially adult orthodontics, and that is a huge factor for your patient's needs. Another very important skill set added to the practice recently is facial aesthetics. And again, not in our skill set, but the whole team approach. We are able to deal with people who want to improve their smile lines, their skin, their eyes. So it's a real team approach where everything is done under one roof. Probably the 2 most important people are the 2 hygienists we have in the practice, because we can't do any dentistry at all unless we've got the proper foundations, like building a house. So we can build all the houses we like. We've got to make sure that those foundations are in good order, they're maintained in good order throughout their life.
What's your ambition for the practice?
Well, my ambition, without being sort of over cocky, it really is that I know and I want this practice to be, you know, the best practice in Ireland and Munster, where people can walk in and go, wow, this is not just cosmetically a great looking practice. You walk in here and go, this team really care for me. This team really care for me, from the nurse to the hygienist to the associate to the orthodontist to the 2 principals. Everybody's working together to help you and to make sure that, you know, that your family and everybody's dental care is under good care. And that's what we want, to be a remarkable practice.